Good morning, good afternoon, and good evening. Welcome to the 473rd day of continuous Zoom session of IFPH. Let us start the program with a silent prayer for 1 minute. Today, our Chief Guest is Dr.S.G BIJU, MD, Chief Medical Officer of the Homeopathic Multi-Speciality Hospital, Changanassery, Associate Professor, White Memorial Homeopathy Medical College, Kanyakumari District. Winner of Best Homeopathy Doctor Award, Government of Kerala. A lot of things we can say about to describe about Dr. BIJU, but I think the most remarkable one is we can have what Hanuman said about the highest duty of a person. If I do not know for what purpose I got put here on earth, to become better myself as far as possible and to make better everything around me. So that is he is doing. He is a self-made improved person, and he also making valid endeavors to make others to improve themselves. We heard a lot of persons who always describe him as the their mentor. A very good and very progressive step from Dr. S.G BIJU, and is a promising star of homeopathy. I am sure about that. He will win a lot of awards in the future. And on behalf of IFPH, I am once again welcoming Dr. BIJU, and the topic of presentation is homeopathic management of a non-communicable disease, NCDs. So now the platform is off for you, or you can, for the next 45 minutes, you can use the platform. Over to you, Dr. BIJU. Yes.
Thank you, Dr. Manoj and IFPH for inviting me again and again to this wonderful platform. I think I am audible.
Yes, of course.
Okay. So for the past 2 years, homeopathy is discussed all over the world than anything in terms of communicable disease. This is not the first time homeopathy has been discussing as a medicine for the communicable disease. It starts from its beginning. During the time of scarlet fever epidemic, then Asiatic cholera, Asian flu, then comes dengue fever. Whenever there is an epidemic, homeopathy has been discussing than anything. And finally, it is stamped that the people believe that homeopathy is effective for communicable disease. And the next sentence is to be underlined. It is only a medicine for the communicable disease. Actually, it is not a medicine for the communicable disease. Even the communicable disease will yield to homeopathy. It is an added flavor for the real potentials of homeopathy, actually. So we have to rewrite it. Actually, homeopathy grows in the management of non-communicable disease, dreadful diseases, or the so-called incurable diseases, or the chronic diseases. And homeopathy stands for chronic diseases too. But it can contribute a lot in communicable diseases too. This is an added flavor only. But unfortunately, our system will be discussed only when there is panic. That is something great, really great. For the past 2 years, all over the world, the people recognize that homeopathy is the only answer for, or a true answer for the pandemic or the epidemic. That is good, but it is momentary. Actually, it is a misconception or a wrong conception regarding homeopathy. We have to rewrite it. We have to break the concept of the people regarding homeopathy. This is high time to do like that and go back to our real potentials, go back to our own field like the non-communicable disease. So this is the theme of the day. Let us break their wrong concepts. So we have to break the wrong concept of the people. Then only we can grow. Then only the real potentials of homeopathy will reach into the mind and heart of the people. So it is our duty to break the concept of the wrong concept of the people. And whose wrong concept? That is a second question. So there are 5 type of people. First one is homeopathy believers and promoters. They too believe that homeopathy is effective for communicable disease and communicable disease only. So we have to convince them, because they are the real supporters of homeopathy. That is a fertile soil for the growth of homeopathy. So even the homeopathy believers and promoters, they do believe that homeopathy is effective only for communicable disease. We have to break their concept. And homeopathy lovers and supporters, but not patients. They are not at all patients, but they are I can see a lot of people participating in this platform. All of them are not the patients. They are not homeopathy patients actually, but they are the lovers of nature. They are the lovers of truth. They are the lovers of people. They are humanitarians and they are supporters. They are the real warriors for homeopathy. They propagate homeopathy than anything among the people. So we have to break the concept of that people too. They are very close to our heart. And neutral, that should be underlined. Not all the officials, neutral officials. More than 50% of the officials are biased. And even politicians are biased. Their face is always turning to the modern system of medicine. Why? Because they do believe that if I have a serious problem, I have to go to the medical college and the allopathy treatment. So, though they are telling that homeopathy is great in our platform, actually they are not real supporters. So that is why I told you neutral officers and rulers, the politicians. So neutral officers and rulers, and never ever try to convince or to break the wrong concept of the ridiculers. They will always ridicule. They are born for ridiculing homeopathy. Let them do. Only because of them, we have achieved that much. And the haters of homeopathy, never discourage them. They are the real, the spark for the development of our system. Do you believe that we have imported medicine from Germany and arsenic album? Imported medicine from Germany, and as per the parameters of the research, it is preparing by the government of Kerala. According to all the parameters of the research, only because of these ridiculers and haters. If they are not there, it won't make happen. So they will be there. Let them keep ridiculing homeopathy. Let them hate homeopathy. Never try to break their concept. Try to convince them. Let them there. So to break the concept, one of the major area where we are playing, where we are doing is non-communicable disease. Actually, my dear friends, a communicable disease will be there, and the outbreak of communicable disease will seldom occur. It is not occurring day by day, but the non-communicable disease, it is occurring every day, every time. It is there, and almost all the non-communicable diseases are chronic diseases too. Do you know the statistics of the year 2017-18? It is not the statistics by WHO available thereafter. In India, total number of death is 58 lakhs people due to non-communicable disease. During the past 2 years, only 2 lakh people died due to COVID in India. But 58, every year there will be 20% increase. So it may be 60-65 lakhs people died. And during COVID time, there were no care at all. So the death rate may be increased. We can do something for the people, those who are dying. Those who are going to die, this 68 lakhs people, instead of doing something for dying 2 lakhs people. So this is high time to think like that. So the non-communicable disease, all of you know what is non-communicable disease. It is a disease that is not transmissible. It is not transmitting from one person to another, directly from one person to another. The major diseases are cancer, diabetes, chronic lung diseases, COPD, heart diseases and stroke, and other NCDs are there. So the basic reasons for developing non-communicable diseases are physical inactivity, alcohol abuse, tobacco use, and unhealthy diet. So these things are persisting, especially in Kerala and in India, and even in developed countries. The basic reasons are there. You can see how the non-communicable disease tree is growing. So as well as the physical inactivity, alcohol abuse, tobacco use, and unhealthy diet is there, the non-communicable disease will be there. So there is ample scope. We can do a lot of things. I am not sure that I can finish all the non-communicable disease, but we will discuss one by one in coming days. Don't worry. So these are the major non-communicable diseases. Cardiovascular disease. People believe that homeopathy can't do anything in cardiovascular disease. No, it is not like that. We can contribute a lot of things. We can prevent cardiovascular diseases. Renal diseases. Lot of renal diseases are there. I'm not going to explain everything. Narrows and mental diseases. Arthritis. Chronic bronchitis. Emphysema. Okay. Bronchial asthma. Cancer. diabetes, obesity, permanent result of accidents, senility, blindness. All these diseases, we are treating all these diseases. Instead of focusing on there are ever so many. I just mentioned the major diseases. Instead of not focusing on this non-communicable disease, if we are running after COVID or a viral disease for years, we are digging our own grave. Never do like that. You may do something for the betterment of the patients, those who are suffering from COVID or endemic diseases. But there is a limit. After that, we have to come back and engage in our actual area. And idiopathic disease, why I put in red letters. So nowadays, you cannot see the word idiopathic diseases under the fall of the so-called modern system of medicine, allopathy. Why? Because idiopathic means the cause is unknown. They are hesitant to admit that we don't know the cause. Actually, they don't know the cause. The cause is unidentified. So that is the thing. Or unobserved. Later they change the unobserved cause. Then again, they are not satisfied. Why? Because they are always telling that we are scientific. Finally, the idiopathic disease, now they put under autoimmune disease. So if an autoimmune disease, we are not scientific, I do agree. But as an unscientific system, we have a question. If it is an autoimmune disease, my dear friends, there should be an antibody. Okay, it is there in SLE, rheumatoid arthritis, polyarthritic nodosa, or even in rheumatic fever, in Sjogren's syndrome, Hashimoto thyroiditis, there will be an antibody. And they put this, what we call psoriasis under autoimmune disease. What is the antibody of psoriasis? Who identified it? And alopecia areata, autoimmune disease. Now the scientific system telling that this alopecia areata is an autoimmune disease. What is the antibody of that? IBS, irritable bowel syndrome. What is the antibody of irritable bowel syndrome? They are simply putting under autoimmune disease because of their lack of knowledge. My dear friends, we know how the psoriasis is developing, how the alopecia areata is developing. The reason may be changing from person to person. How psoriasis or how a systemic lupus erythematosus is developing. While taking the case, we will identify where the fight was, what was the reason for that. And in homeopathy, there is no disease without any reason. Either a miasmatic reason or a psychosomatic reason. We had lot of lectures here in this platform itself. Dr.S.G BIJU sir, Shaji Kudiak, Corbett sir. I heard lot of what I heard. I remember the disease starts from the mind. So they are hesitating to admit that, and they are putting under autoimmune diseases. This is a vast area. We have to step in, or we have to exploit the potentials of homeopathy and chronic results of communicable disease. This is the only area we have to focus right now. Now what I'm doing is I'm doing the post-COVID complication cases. Last time we discussed a case. I just show it for those who didn't attend the last session. That was a post-COVID rhabdomyolysis. I'm not going to explain everything, but why? Because it was explained in the session surgical diseases in homeopathy in surgical disease. Okay, this was a case suggestion for amputation, rhabdomyolysis, post-COVID and post-steroid complication. Rhabdomyolysis. This was a case we discussed that in the last session, and Lacasis and Seclicora was given after 1 month, and after 2 months, and after 3 months, and after 5 months. Okay, 4 months. On 5th month, there is no amputation. This is the area where we have to treat. Nowadays, I am doing post-COVID, this what we call fibrosis of the lung. So our area is to treat post-COVID fibrosis of the lung, not the COVID cases. Let them do. So we can focus on post-COVID fibrosis or the let us break their wrong concept regarding homeopathy. Homeopathy is running after every viral disease. If there is a complication, if there is a sequelae, then only call our help, because we are something different. This is not our duty. So the major non-communicable diseases are cardiovascular diseases, diabetes mellitus, COPD, lung disease, and cancer. If you are focusing on these 4 areas, that is enough for nourishing homeopathy and homeopaths for the next 150 years. I'm guaranteeing. We have to focus on diabetes. We have to focus on COPD or lung disease. We have to focus on cancer. We have to focus on cardiovascular diseases. It is just for an information, for just to remain the IFPH people. The World Heart Day is on 29th September. I request the IFPH to conduct special program on cardiological disorders on World Heart Day on 29th September and World Diabetic Day 14th of November. So there should be a special program because it is our cup of tea. We are the only people, those who can conduct a seminar or a propaganda program regarding diabetes, because there is only one system in the entire world that can offer permanent cure for diabetes. I can show you the result in coming slides if time permits, or in coming days I will show you. So there is only one system. So it is our right to conduct. And it is not the right of a system which can treat but not cure diabetes. So this is our day. And World COPD Day on 20th November and World Cancer Day on February 4. So we have to conduct programs. And this is a thing. I think there are people not out of the photo who they are attending this session. Possibility of dying between 30 to 70 due to non-communicable disease is 23%. Those who are attending this webinar, 23% of participants may die before 70 years due to non-communicable disease. It is a fact. It's a proven fact. I'm not making you scared. This is a fact. We have to identify. And 30-year-old individual, those who cross their 30 year, has 1/4 chance to dying from non-communicable disease before 70 years. So those who are crossing 30 years, those who are having 30 or more years, 1/4 of the people won't see their 70 years. This is guaranteed. If they are not properly treated and properly lived. Okay, risk factors are chronic respiratory disease, diabetes, cancer, and cardiovascular disease. These are the major reasons for death. The so-called 58 lakhs people died in Kerala, in India, due to these diseases. So we have to focus on that area. Let us come to the therapeutic part also. 71% of the lung cancer and 42% of chronic respiratory diseases and 10% of the cardiovascular diseases are due to smoking only. It is not banned in any country. In any country, they are charging, they are taxing only. Every budget there will be increase of tax. Nobody is banning, and alcohol is also not going to ban. Don't worry. For the next 150 years, it will be here. And in countries where the alcohol is banned, then again the cigarette is there. So what we can do? That is $1 million question. So what homeopathy can do in smoking? So we can do. Okay, as a prevention, Caladium Secundum 30 and Plantago tincture. These are the two major medicines. Somebody may continue smoking, but they will reduce the number of cigarettes or the frequency. And most of the people will stop in between because there is a burning desire in their mind also. So Caladium and Plantago, these are the chief remedies to prevent smoking. And for smokers, so this is one area we never exploited. So we have to check the urine nicotine. The 600 rupees is the charge for urine nicotine in India or in Kerala. So that the charge may be varying. So we are not doing that for all smokers. We have to do the urine nicotine. Nicotine absorbed from the tobacco smoke is in a part excreted in the urine. So two medicines are there: Tabacum 30, BD, and Aquaca Aba 6, TDS. The dose can be changed according to the number of cigarettes. So this is a detoxing program. My dear friends, let us break the conventional concept of the people that Ayurveda is best for detoxing. There are a lot of detoxing projects running all over India. One of the best detoxification program has been run by Dr. Isaac Mattay Norland in Saukia. the you can't believe the charge he is taxing, because he is delivering what he is offering. That is why he is charging. So let us have a small detox program. This is for smokers only. Nicotine you have to check. So let us have a general detox program. Then come to. So we are preventing a non-communicable disease. The major reason for non-communicable disease is smoking, alcohol, lack of exercise, bad variety of life. Okay, lifestyle. Okay. So what we can do? So let us have a detox program. So we have to take the screenshot or keep it in mind, because it will be applicable for every detox program. So there will be a 4-month detox program. If a person want to detox himself, they can go to a homeopathy doctor and join in a detox program. And I request you to don't give it free of cost. Charge heavily. Why? Because it is a detoxing program. Then only people will believe. Then only people will take the medicine, and then only people will keep on to the diet and regimen. Okay. So the first month, Calmec tincture, 8 drops BD for 1 month. So that is for first month. Followed by Berberis vulgaris tincture, 10 drops BD for 1 month with enough water. That should be underlined, with enough water. That is mandatory. Berberis vulgaris, you never give Berberis vulgaris without hydrating the patient. So there will be dehydration. With enough water, followed by Sarsaparilla tincture, 10 drops BD for 1 month. This is the 3rd month. And followed by Echinacea tincture or Cucurma tincture. Echinacea tincture, it is called as a blood purifier. Cucurma, you know, that is more detoxifying effect is there in Cucurma. If there is intestinal problem, if there is cardiac problem, if there is respiratory problem, a better option is Cucurma. If there is no systemic disease, a better option is Echinacea, 10 drops BD for 1 month. This is a basic detox program. So Calmec tincture, 8 drops BD for 1 month. 2nd month Berberis, 10 drops BD for 1 month. 3rd month Sarsaparilla, 10 drops BD, and last month Echinacea or Cucurma, 10 drops BD for 1 month. And take the patent of all these medicines. Otherwise, people, the Cucurma is already used by the other system medicine. Okay, this is a general detox program. And for smokers, a special detox program. Okubaka was 6C, I mean, 5 drops BD and Secyl core 30 at noon for 1 month. The Secyl core will remove the tar from the alveoli for 1 month, followed by Tabacum 30 BD for BD, followed by the general protocol. General protocol, you remember? So the same thing. Calmec, Berberis, Sarsaparilla, Echinacea. Okay. So for smokers, first of all, we have to do Okubaka 65 drops BD and Secyl core at noon for 1 month, and 2nd month Tabacum 30 BD, then followed by general protocol. So it is a 6 months program. So we can offer a 6 months program, and you should test the first thing, what I call urine nicotine at time to time, and convince the patient that he is detoxified. And if there is liver problem, you can check the other things also. Okay, homeopathy can prevent death. It is not mandatory to go for modern medicine treatment, auxiliary methods, everything. We can also prevent death. Let us break the wrong concept that the modern medicine is saving the cardiovascular diseases, COPD diseases. They are doing the end time program and end time help. Just like the Khalasis, those who lifted the derailed train from the track. It happened some years back at Kollam, Perumal. We are the trackmen who keep the track clean every day. So we have to be honored than them. They will come when there is a disaster only. This has been we are seeing for the past 2 years. They are running after the disaster, and when the disaster becomes a comedy, they left the place. Now they are not doing. There is no CFLTS at all. There is no PP kit at all. Even there is no gloves at all, and even no mask at all. So now the disaster is over. Okay. So let us break the wrong concept of people that we are not treating cardiac disease or the pulmonary disease or the dreadful disease or the non-communicable disease. So the obesity, another thing. If you start an obesity clinic in Kerala, that itself will feed you for next 10 years. So 1.6 million people are dying every year due to physical inactivity. Simply sitting and dying, not doing anything. That is a problem. Okay. So we have a program there. Not simply with medicine we can do. So I did it. That is why I'm telling. This is myself. I was 86 kg and reduced to 77. Now 76. Now 3 kg excess because of lack of exercise. So my diet program was done by Dr. Jamil said. You know he is running an obesity clinic named Simlux. I think he took a session here. So Kalkinakar weekly doses capsicum BD, 6 CBD, Phytolacca, all of you know, 15 drops BD. That to burn the fat, and low carbo diet, regular exercise and control life for 1 year. Within 1 year, I could reduce 12 kilograms. And the shape has been changed. You must see. The first one is look like a pig, okay, and then next one is also look like a pig, but a lean pig. That's all. So you can make it happen. So if you are starting an obesity clinic, you are not simply tapping money. You are saving a generation. You see, 1.6 million people are dying due to obesity. If we can save 100 people, that is something great. No system is saving 100 people, maybe 10 people. And liposuction, there is a surgery, but that too make problems. So we can have our medicine along with exercise and diet. You can have a program for 1 year. So this is the potential area, space for homeopathy. We have to put our nose into the matter and do something. Let us break the wrong concept. The obesity clinic can be well run by a homeopathy doctor. There is a clinic run by Dr. Mini and I think the wife of Dr. Arif, Shahnas at Chartala. I referred cases to them. Very good result. People are very much satisfied. Okay. So let us break their wrong concept regarding the obesity. So we can do something in obesity also. And the harmful use of alcohol. Alcoholism in Kerala. We have to take it as a social responsibility. We are not going to fight against alcohol. We are going to give medicine. We did it for the past 15 years and we are getting very good results. So we did a program at Atmada Kendram, Changaneshwari, one of the top non-government organization in South India. Okay. So 3.3 million people died each year due to alcohol. So 1.5% of DALI means daily adjusted disability adjusted life years. So there are ever so many millions of people are living with the disability adjusted life. So how many years they are living? They are not taking the best out of them. So if we have a program to take the best out of them, definitely the government will accept us. There is only one way to convince the government. We have to do it and prove it. Simply telling, simply striking, simply making propaganda, simply making noise is not enough. We have to convince them. So what homeopathy can do? We'll see. This is Atmada Kendram. This is a de-addiction center run by the diocese, Changaneshwari Archdiocese. The program, the name of, because we are living in the center now, nobody is interested to stop alcohol. So we make it the name as Atmada Homeopathy Alcohol Limitation Therapy. So you can limit it. So attracted people and 4,682 families are served with our medicine. Dr. T.N. Parameswar Guru is in charge of that program later on. So alcohol limitation therapy. It is not at all limitation. It is abstinence itself. So this was a center. You can see the homeopathy chilsa, homeopathy treatment that is there in their board. It is there for 15 years. We have been running this HALT project for the past 15 years. So for alcoholism, we have our own dimensions, our own reasons why people are taking alcohol. It is not just because of availability. It is not because of lack of awareness. It is not because of outlets. It is not because of the policy of the government. In some cases, it is due to grief. Then causing some medicine. My dear friends, there is no medicine in any system to abstain a person who is having alcoholism from grief, except in our system. But we are not utilizing it. That is a problem. Caustic manam is enough. And alcoholism due to NUTD means boring. After retirement, he is not able to do anything. And in Hartal days or the Bandh days, why people are taking alcohol? It is a normal custom and people are ridiculing them. That is NUTD. Because they will get bored. They can't go anywhere. So they are get bored. Then only they will take. Naxomic and Lacus are the medicine. And due to hypochondriasis, due to fear of disease, some people, they are very much afraid about diseases. They are doing investigation after investigation. And they are always telling that I am having some diseases. You please do a whole body check. But they will take alcohol also. So that is an irony. The reason for the alcoholism is hypochondriasis. That is naxomania. Due to irritability also. So there is irritability. So after taking alcohol, he will be calm. And due to shyness, I remember a teacher who is taking alcohol for, he is a very good announcer, MC, Master of Ceremony. He is inviting dignitaries to the dais. He is speaking very well and doing the announcement and all. But actually, he is timid, shy, just like lycopodium, he is timid. To cover up the shyness, he is taking alcohol. Whenever there is program, he will take alcohol. Otherwise, no problem. Mersol and Madonna, he was saved with Madonna. And due to weakness of character, some mental characters like behavior abnormalities, Pulsatla vannam, petrolin 200 and arsenical vannam. And just to get an excitement. Some people are like that. Let us have 2 peg, then go. That's all. They will take only 1 or 2 peg. Then the quantity will increase. That is zinga metallicum, especially wine. Wine is an antidote for zinga metallicum also. Never allow them to take wine. Okay, and withdrawal symptoms. We admit cases here and giving medicine. In the midst of night, we are giving medicine. Stramonium is trembling of hands. This is a major thing. And redness of face, calibromatum. Sleeplessness, this is very, very important. Semicifugia 200 with hallucinations and with hysteric symptoms. And apomophobia 6 with nausea and vomiting. And califos, nervous irritability, sleeplessness. With these 3 medicines, people will sleep. If they are not sleeping, what the other system they are giving, they will give sedatives or they will give the alcohol itself. So there is absolutely no need of alcohol. These 3 medicines are enough. And ranunculus bulbosa, body pain. After withdrawal, there will be body pain. Those who admitted in the this de-addiction center. And headache, Ruta 30 and Lacus 200 during withdrawal. Usually people will reach at our center for admission after a heavy intake of alcohol because they are going to stop tomorrow, or they might have unconscious in the previous night and somebody pick them and bring them to our station. So at that time there will be severe headache. There is absolutely, they will tell that give me 2 bucks, my headache will be over. It won't happen, my dear friends. Ruta is enough. No need of 2 bucks. 2 drop is enough, and followed by loss of lacuses and mild withdrawal symptoms with hyperactivity. People will make problem. People will walk around like that. Cypripede is the medicine. Okay, this is the finding in our study. 68.9%, around 69% of alcoholism are having families. Nobody is inquiring about the families except homeopathic doctors. Why? Because even though there is family history of alcoholism, they are giving the same medicine. But if there is family history of alcoholism, our medicine is enough. You have to give. A single dose is enough, followed by the other medicines. If there is family history of alcoholism, we have to give a no-sort. A better option is a single dose of syphilinum tandem or 50 potency. So 68.91% of people are having families. This has to be considered very seriously. While we are taking awareness class, we will tell the people you have to take care. If you are having the alcoholism, if you are continuing it, there is every chance of the carry of this tendency to your next generation. That is civilum tenum. Tenum will break the genetic tendency. So these are the medicines given. I am not going to explain all the medicines. The chief remedy is Naxomia. So whenever you are getting an alcoholism case, try Naxomica first. One of BD 2 times a day. My suggestion is for a minimum of 60 days. There will be a relief in the first 2 weeks. Then there will be an aggravation. Don't stop the medicine. Give the medicine continuously. And if it is not relieved even after 90 days, switch over to other medicine or refer the case. But we are now we are doing what much result we can tap from Naxomica that we are taking. Otherwise, we'll skip the case. So syphilinum will act as a in gene in patients with hereditary alcoholism and saves the next generation if give before marriage. This is something important. People will compel the patients, alcoholics, to get married. Then you will be okay. They won't become okay. After marriage, they will become suspicious because they are getting the freedom to show anything to their wives. So if an alcoholic is going to get married, first of all, we have to inform the family. Nobody will accept that. And if at all married before giving birth to the next child, you have to give a dose either to the mother or to the father. It is better to give the father before giving birth to the child. So the genetic chain will be break. So we observed it. Okay. Alcoholism with psychosis and alcoholism for ostentation. That is Madonna. Alcoholism with the psychosis means it is just like the psychosis will be there. That is a mental disease. There will be a mental disease. To cover up the mental disease, patient will go for alcohol. It is just like a mud placed or poured on your table. So you can do one thing, you can wash it out, or you can cover up it with the paint. Once the painting is or coating is over, if it is vanished, the mud will come out. So when you are treating a case of alcoholism with psychosis, please take care that while you are treating, the alcoholism may go and the patient may become mad. Usually the blame will be upon your shoulders. I got it number of times. After taking homeopathic medicine, the patient become mad. Actually, he is mad. And to cover up the madness, he took alcohol. We treated only for alcoholism. So it is better nowadays. What we are doing, we will refer the case to Central Research Institute. They will do it wonderfully. Or we have to convince the patient that, or you are not supposed to treat alcoholism. You are supposed to treat the psychosis or the mental diseases. And hypersol, impulsiveness. They will put things in fire. Hypersol patients will put things in fire. So I remember a case of tobacco addiction. He was the managing director of the TESIL, Ramki Cochin Electrochemicals. That factory is not there now. It is burned. And he reached at me some years back, 21 years back. And I asked him, how many cigarettes do you smoke a day? He told me that 20 packets. 20 packets come 2,200 and above. And I asked him, how can you take breath and how can you take food in between after smoking 200 cigarettes? And his wife told me that, no, it is not like that. He will light the cigarette, took 2 puffs and throw it away. And I asked him, why you are throwing it away after firing it? And he told me that it gave me an excitement when I lighted the cigarette. So actually it was pyromania. And what I gave him a parcel, but it was too late. What he did, he put fire to the TESIL. He made lot of problem, and the factory was spoiled. He likes the fire. So the put things in fire, that is an impulsiveness. Alcoholism with the destructiveness, desire to put things in fire, that is a person. So see the multitude of our prescription. And alcoholism from indignation or mortification. He did that to me. That is why I am drinking. I was treated by my brother-in-law or father-in-law or my wife. That is why I am taking alcohol. And there will be alcoholism plus tobacco addiction. The outburst of suppressed emotion. And after taking alcohol, they will tell you, do you know who am I? That is their problem. People doesn't know who is he. If you admit him, if you admit his ego, he won't go for alcoholism with a dose of stabilizing. This is alcoholism. And alcoholism of artists. I have no words to tell you. That is nothing but tuberculosis. We lost a very good number of artists in Kerala, all over the world, starting from Michael Jackson, lot of people. So this is the addiction of artists. There is a positive thing. They are artists. Just see what is positive in them. Give a dose of tuberculosis. That will definitely save the patient. Maybe continuing the alcoholism. I am treating celebrities, but it's a controlled drinking, and there won't be any pathology. I'm giving only this tuberculosis. There is absolutely no question of Naxomic or any other medicine. So this is a conclusion in our study. Homeopathic medicine is found most effective in treatment of alcoholism is Naxomica one potency 2 doses daily, morning and evening. It has to be given like that. Why? Because this is our experience. There is no explanation for that. This is our experience. We gave it weekly doses, daily 1 dose, and repeated once in 5 days like that. Anyway, it has to be given morning and evening, knowingly or unknowingly. You have to give. So this is the conclusion. And what I told you, the government will definitely admit you. There is a ministry. I don't know how many of you know, Ministry of Social Justice and Empowerment. That is a ministry under Government of India. You know, you see the National Institute for Social Defense. This is a publication of Ministry of Social Justice and Empowerment. My dear friends, this is the study report published by the Government of India. There is no other way to convince the government. I told you in the beginning, except showing them the result. They published it. They published it in the government publication by the Social Justice and Empowerment. You can approach the Ministry of Social Justice and Empowerment and show that we can have an answer for alcoholism. Definitely, they will fund for you. This is now the project is funding with the central ministry, but in the beginning it was funded by ourselves. So you will get recognized. Why? Because the Ministry of Social Justice and Empowerment recognized that we are saving number of lives. So we can save number of lives. So we can see. Okay. Just a second. Manoj, shall I stop here? Our time is over.
Yes, I think we can have a discussion, doctor, and can have another sessions in the coming days.
So we will do. I will just show you a video. Then we will stop and we will have discussion.
Okay.
Just a minute.
Okay.
അതിരൂപതയുടെ ആരോഗ്യ സേവന വിഭാഗമായ ആത്മദാ കേന്ദ്രത്തിൻ്റെ ആഭിമുഖ്യത്തിൽ കഴിഞ്ഞ 12-ലധികം വർഷങ്ങളായി ലഹരി ആസക്തർക്ക് വേണ്ടി നടത്തിവരുന്ന ലഹരി ചികിത്സ പദ്ധതിയാണ് എ ഹാൾട്ട് പ്രോഗ്രാം. ഇത് ആത്മദാ കേന്ദ്രം തുടങ്ങിയത് ചങ്ങനാശ്ശേരി മൾട്ടി സ്പെഷ്യാലിറ്റി ഹോമിയോ ഹോസ്പിറ്റലിലെ Dr.S.G ബിജുവിൻ്റെയും ഡോക്ടർ ശരത് ചന്ദ്രൻ്റെയും ഡോക്ടർ പരമേശ്വരക്കുറുപ്പിൻ്റെയും നിസ്വാർത്ഥമായ സഹകരണത്തോടെ ആരംഭിക്കുകയുണ്ടായി. അതിനുശേഷം ഞങ്ങളുടെ ഡോക്ടർമാർക്ക് വേണ്ടതായിട്ടുള്ള പരിശീലനങ്ങൾ നൽകുകയും ആ പരിശീലനം സ്വീകരിച്ചതിന് ശേഷം ഞങ്ങളുടെ ഡോക്ടർമാരും ഈ ബഹുമാനപ്പെട്ട ബിജു സാറിനോടും പരമേശ്വരക്കുറുപ്പ് സാറിനോടും അതുപോലെ ശരത് ചന്ദ്ര സാറിനോടും ചേർന്നുകൊണ്ട് കേരളത്തിൽ അങ്ങോളം ഇങ്ങോളം ഉള്ള വിവിധ ഗ്രാമങ്ങളിലൂടെ ഈ സന്ദേശം എത്തിക്കുകയും ചെയ്യുന്നു. കോട്ടയം, ആലപ്പുഴ, പത്തനംതിട്ട ജില്ലകളിലായിട്ട് ഏതാണ്ട് 6000-ലധികം കുടുംബങ്ങൾക്ക് സ്വാന്തനമാകുവാനായിട്ട് ഇതിലൂടെ സാധിച്ചിട്ടുണ്ട്. ഇതിൻ്റെ ചികിത്സയുടെ ഒരു പ്രത്യേകത നമുക്കറിയാം, ഹോമിയോ ചികിത്സയ്ക്ക് സൈഡ് ഇഫക്റ്റ് ഇല്ല എന്നുള്ളതാണ്. അത് തിരിച്ചറിഞ്ഞുകൊണ്ട് അനേകം ആളുകൾ ഇപ്പോൾ നമ്മുടെ വ്യക്തികൾ തന്നെ വരികയും അതല്ലെങ്കിൽ കുടുംബങ്ങൾ വരികയും വന്ന് മരുന്ന് മേടിക്കുകയും ചെയ്യുന്ന സംവിധാനമാണുള്ളത്. അതിനോട് ചേർന്ന് പ്രവർത്തിച്ച് ഈ പ്രസ്ഥാനത്തോട് ചേർന്ന് പ്രവർത്തിക്കുവാനായിട്ട് എല്ലാവരെയും സന്തോഷപൂർവ്വം ഞങ്ങൾ സ്വാഗതം ചെയ്യുന്നു. ഏതെങ്കിലും തരത്തിലുള്ള കൂടുതൽ സർവീസസ് നിങ്ങൾക്ക് ആവശ്യമുണ്ടെങ്കിൽ ആത്മദാ കേന്ദ്രത്തിലോ അല്ലെങ്കിൽ Dr.S.G ബിജുവുമായോ ബന്ധപ്പെടുവാനായിട്ട് എല്ലാവരെയും ക്ഷണിക്കുകയും ചെയ്യുന്നു. ശരി, അതിരൂപതയുടെ ആരോഗ്യ സേവന
So this is Atmada Kendram. those who want to conduct such a program at your station, all over the India, we are offering. You may contact in this number or in this address. If you are not getting patients, don't worry. They will bring the patients. They will announce in the church and they will find out those who are alcoholic and they will bring the patients to you. And we will give you the direction how to treat the cases. Try to convince them. Try to win the heart of the people. So those who want to conduct such a program, they may contact you. You may just take the screenshot and you may directly contact them. They will arrange everything. So we are doing this program all over India, including in Mangalore, Bangalore, like that. So if somebody want to do, or if in abroad also, you may contact them. They will direct, because there is there are enough records, there are enough testimonies and study report also, and we will definitely help you. So we just go through only two things. One is smoking and alcohol, and a small session on obesity. The major diseases are there. Cancer is there, diabetes is there, COPD is there, and I am ready to give you sessions, if you permit, on coming
Yes,
Fridays.
of course. There is no doubt about that, doctor. Yes, we are always.
Other things.
Yes.
So you may ask your doubts and we will discuss.
Yes. Well, very nice presentation. Absolutely fantastic one. And we can say you did won the heart of the listeners. And I think the one point you just mentioned is very remarkable. The pitch of the sentence: no two pegs, but two drops of medicine. That did show your confidence. That is what we require from you and the homeopathic fraternity. Time to go to the question answer session. Those who would like to participate can please go to the participant list and raise your hands. Yes, Velapan sir, please. Dr. Velapan sir, please unmute yourself.
Thank you, sir. Hello, Dr. Biju sir. Hello, you are doing very good service. As a product of JCs, you are doing a social service with so many organizations. My request to you is that the new COVID Omicron. Yesterday also in our IFPH, we were discussing about how to prevent the fear and other disadvantages of vaccination. So I request that
Velapan sir, please. There is some audio disturbance from you, Velapan sir.
Okay.
Some television or other thing. Please do that. We can't hear you properly.
Please unmute and give permission to
Okay. Switch off it. Okay. Is it clear now?
All right.
Is it?
Yes, sir.
Okay. Thank you. My suggestion is that your powerful suggestions and capacity, personal capacity, you can do wonders to the homeopathic world and the humanity also, because the Omicron, the true picture is not aware by the majority of the mass. So if as an international organization, we will take up the leadership for making the public aware about the Omicron.
Yes.
And save our new generation also from this medical mafia. So as you know, the vaccination medicine is capable of making changes in DNA also. So for the sake of our new generation, next generation, I request sir and other doctors also to take initiative, to take leadership in the world. It's a global service for this awareness. Thank you, sir. Thank you for your service.
Okay, thank you, welcome, sir. Sir is the JC and he is always an inspiration for us. And regarding Omicron, I will finish within 2 sentences. Omicron is a failed propaganda actually. They couldn't do anything. It became a comedy. And if Omicron is coming, what I am going to do, I am not going to treat it as a COVID case. I am just giving Belladonna and Restos. That is enough. And nobody is afraid of Omicron right now. And secondly, vaccination. We all are talking about against vaccination. We all are making awareness regarding vaccination. But 90% of people, those who even believe us, they are not for vaccination. So let them take vaccine. And I have a record. in all my case records, if at all, if the patient is complaining about vertigo, nausea, newly developed hypertension, diabetes, I will ask a question whether you vaccinated or not. I recorded it. So we can prove that these much of people suffer from or switch over to diabetic or hypertension after vaccination. It may come down without any medication also. Let them take vaccine. Let them make autoimmune disease. I'm a businessman. We have to treat it. Nobody is hearing us. Why should we shout on the dumb ears of the people? They are running after vaccination. So it is high time to treat the byproducts of the disease. They are also doing like that. I'm talking as a businessman, right? Not as a serviceman. I did a lot of services. I do honor the real anticipation of wellness. I know what you mentioned, but because of frustration, I am telling, we have to take an ulta, an upside down decision. That is better. When people are referring COVID case to me, what I am telling, go to CFLTC. There are allopathic doctors. They are sitting alone, ideal. Let them do. Why? Because I am treating diabetes mellitus, I am treating bronchial asthma, lot of cases are there. Why should you run to me? Run after them. They are told that they are the mandatory people. They are only capable of treating COVID cases. Let them treat. Go to the hell, the communicable disease. Let them treat. Let us see how they are going to treat. That is my attitude. Sorry for responding. I am not responding to Alvin sir. I am responding to the bird.
Yes.
No,
Yes, no, there is no problem. Yes.
okay,
it is
I
also
really
needed.
understood your emotion. So our responsibility as the general people is ignorant. So it is our duty to
Okay.
make them aware of the things.
Yes,
Because
sir.
Yes,
constraints for them.
Sir, everybody knows that. We don't
Okay.
don't waste our time. Let them do
My
what they want.
As
Okay,
a
okay.
doctor, my duty is to fight against alcohol. Instead of that, let them sell. I will treat. That is through that also I am doing my duty to the society. Instead
okay.
of running a rally from Kasaragod to Trivandrum against alcohol, let them take. There is a beverage outlet behind my clinic. Let them take. I will treat them. So I will do my duty only through duty. Okay.
Okay, thank you, sir. Thank you for the service. All the best.
Okay. Very brave words. Now, Dr. Hubert Disilla, yes.
Hello, doctor. Can you hear me?
Yes.
Can you hear? It was a very wonderful class, and you are always opening new ways. You know the social psychology of the people. Today, one case I just remember. I just going to your one word. Today, one lady came, and she passed somewhere. She planned to came my hospital. She goes somewhere. She passed my hospital and go somewhere, and she told me that she took 2 days back, she took vaccination, and now her BP is 119, 90. That is what is happening. 2 days back, she had COVID, and this is a condition of the common people. I don't know. I think that they don't know how to discrete the things. They even lost their consciousness and everything. This is what is happening now, taking vaccination. So your class was great, and this type of points should be come in front of our platform. That is what to do the next thing. We may be very much thankful to you, very much grateful to you, sir. Your words are very great, and wisdom, it's full wisdom.
Yes.
Thank you, sir.
Okay.
You have to record one point. For the past 50 years, what they are writing in their case record, took homeopathy treatment. If there is a renal problem, took homeopathy treatment. If there is a bronchial asthma, took homeopathy treatment. If there is diabetes, took homeopathy treatment. So you have to write in your case record, took vaccination. So this is
very good. Yes, that's a fitting required. Yes, that is needed. Yes, no doubt. That is everybody knows what is the complication of vaccine, but they are still going behind that. Let them go. Let them perish if they
make
want.
records.
We don't
Not simply without evidence we can say. Dr. Hubert, that single case itself is a record. Make enough records and pull it in IFPH platform. I am ready to pull it. with the address, phone number, everything. What is happening? What happened after vaccination? And they are ready to tell also. And try to convince the patient also. Tell them it is because of vaccination. Nobody will hang you. Nothing will happen. These people are unknowingly they are telling that the homeopathy medicines are the bomb to the kidney. Then why can't we tell the patient that it's only because of vaccination? Even they don't know. So tell the patient, record it, make records, and pull it together, and we will show the world after some day. Will do.
Okay, yes. Now till Dr. Dhanesh. Yes, Dhanesh, Doctor, please. Unmute yourself, Dr. Dhanesh. Yes.
Good evening, all, and good evening, Dr. Biju, for a wonderful presentation. And I must say that this is one of the mother of all presentation, because you have shown the courage and conviction that some cases that is really uncurable can be cured with the homeopathy in such a beautiful way. And you even shown how beautifully the medicine can be used in different stages of a particular disease. And this is something extraordinary. This is something that our new generation doctors are looking for. And that's the reason why the number of participants really increase in this forum tonight. And this really big boss to all people, including we people. We are really thankful for you to coming out this session and presenting such wonderful cases. I must add to some points here, because as you just told that the vaccination, I too have a case. I have got two cases from these complications today. One patient who was having who never had hypertension in his life was unable to walk. He was a sweeper in a veterinary hospital here, and he was suffering from high hypertension, and his BP was 210/110, and he was even not able to walk in a proper way. I took the video out of him when he was returning from he was going back from my home. I took a video from the back, so that I kept it as an evidence with me. And another patient who was a lady who was working in a factory. She had a severe pain in leg. She cannot even stand, because she told me that everything happened after this first dose of vaccination. So these two people are not now, they are reluctant to take the second dose, because they find it very difficult to live for their bread and butter if they take the second vaccine. So the people themselves are reluctant nowadays, and so this is the thing I would like to add to here. And thank you, Dr.S.G BIJU sir, for coming over here and delivering such a beautiful presentation. Thank you once again. Hope you will come with the second part of the same in the coming days.
Thank you, Dr. Dhanesh. Yes, Dr.